So they experimented with prefrontal lobotomies for a number of years. I think the last one was done in the United States early 1970s maybe, but again, like with the insulin shock treatments, they were either killing a lot of people or turning them into vegetables. But a lot of people wound up in a vegetative state. But they had enough promising results to keep doing it, and they did continue to experiment with it up until at least the late 60s and into the late and maybe the early 70s, but they don't do it anymore. It's now been outlawed. But what really turned the corner was the beginning of the development of psychotropic medicine to treat mental illness. And the first ones began to evolve in the late 1940s. Thorazine, which is still used to this day to treat psychosis, was in experimental stages in 1948 and was ready for the mass market in the early 1950s. And it was used to treat schizophrenia and psychotic disorders. Another medication came along called Miltown, which was used to treat depression. Then they discovered lithium salts, LiCO3, lithium, which is marketed today, still used to treat bipolar disorder. They learned that lithium salts was an effective treatment for bipolar illness. In the same way, phenomenological study, they found there was a village in France or Switzerland, I can't remember, that they never had a recorded case of bipolar illness at the time, called manic depressive illness. They'd never had a case of it in a small village in France or Switzerland. And so they did an epidemiological study and an environmental study, and they found that there was a high concentration of lithium salts in the town water supply, in the town well. And so people were getting treatment for that. Lithia Springs here in Georgia, out Douglas County, just past Six Flags, there's a spring that has a concentration of lithium in it, and people, the Indians, Native Americans, used it for medicinal purposes to soak in the springs and drink the water. And then people used to come from all of the United States to go to Lithia Springs to get the water to treat various illnesses. And so it's been refined and used to treat manic depressive, or known today bipolar disorder, since the 1950s as well. So medication really started coming into the picture in the 1950s. As with anything, anytime you invent a technology or open the door in a technology, it leads to this one, leads to two more, which lead to two more, and it becomes geometric, the multiplication. And it had many effects. From the 1950s, when medication was first starting to come onto the scene, the average length of stay in hospitals moved down from about 2 years, which is what it was the turn of the 20th century with Clifford Beers. In 1959, it was still 2 years. If you went in the hospital, you were going to stay in the psychiatric hospital or asylum for about 2 years. By 1971, largely due to psychotropic medication, the average length of stay had gone from 2 years down to about 30 days on average. Stay in a mental hospital. So it dramatically improved the care that people received in hospitals, dramatically improved the quality of life for many, many people. And they're still developing medications today. The 1980s, 90s saw a huge wave of medications for the treatment of psychotic illness. Lots of people who had been suffering from schizophrenia and were not able to be treated responded to these medications. This group of medications, and SSRIs, selective serotonin reuptake inhibitors, came along in the 1990s as well, which were just a huge boon for the treatment of depression and are extremely widespread to this day. So that's kind of the history, just in a nutshell, of the care of the mentally ill. Stepping over to reimbursement for just a second. Hospital insurance didn't always exist. In fact, it didn't come along until the 1940s when Kaiser, which you probably have heard of today as Kaiser Permanente, Kaiser created a product for their employees at Kaiser Aluminum that would cover medical care, and they created centers for their employees to go to receive free or extremely low cost medical care. And that kind of set off a wave of reimbursement for medical and mental health treatment through insurance companies. It's grown. Today, the market is fairly well dominated by third-party payers, and it's expensive. That's one of the cost drivers. That and government regulation have really driven the cost of the care for medical illness and mental health issues for a lot of years, since the 1960s. Great Society programs, the 1960s, Medicaid, Medicare, have really driven the the expenses of mental health and medical treatment. Because, hey, if somebody's going to pay for it, why not charge whatever you want to for it instead of charging what the market will bear? So anyway, not going to steal any more thunder from the PowerPoints and from the readings. Just wanted to give you kind of a down and dirty quick sketch about the history and trends in mental health care, and you'll get more about reimbursement. I don't want to go into that. I'll just get mad anyway, but it's as an aside. So I hope that you have a good week. I hope that you master the material fairly readily. Don't forget that Friday, there will be a 50-item quiz open up. You'll have this video, some other videos, a 10-item quiz about the videos. Then you'll have additional readings. You'll post on the discussion boards about the readings. Then Friday, one of the 50-item quizzes will open up. It will cover the DSM and psychopathology section module that you did last week, and this history and current trends in mental health care and reimbursement module that you're doing this week. That's what the 50 items will be on the test on Friday, that opens up Friday. As always, feel free to call at any time if you got a question or a concern. I've done some advisement on Zoom, and it worked really well. If anybody still needs advisement, do the program planning sheet, etc. And email us with any questions. Me, Mary Elizabeth, Caroline, or Ralph are all happy to answer whatever questions you have or troubleshoot any issues that you might have. So stay healthy, stay indoors, practice social distancing, keep yourself safe. I hope that all of you are doing well. And Lord willing, we'll see you before too long.